My name is Analise Douglas. I'm one of the interventional cardiologists here. I joined in 2024. All of the people that are at risk for coronary artery disease are also at risk for heart failure. Because the most common cause of heart failure is coronary artery disease, some of the same risk factors are included here, including diabetes, high blood pressure, people with valvular disease or valves that are abnormal, people who have congenital heart disease are also at risk. For primary causes of heart failure, I like to think of it in two categories, which are people who have coronary disease as the cause for heart failure and people who don't have coronary disease as their cause for heart failure. The people who have coronary disease, it may mean that there are blockages that may need to be taken care of in order to restore the function of the heart. And then people who don't have coronary disease, this kind of includes the people who have high blood pressure, people who have thyroid disease as a cause of heart failure, people who have valvular disease like I talked about before. All of those things can also cause heart failure. There's also some familial heart failures that run in families that are related to gene mutations and others that we have not found the gene that has been running in families that cause heart failure. That family of heart failure is called the non-ischemic or non-coronary artery related heart failures. Also, arrhythmias can lead to heart failure. So there are many symptoms of heart failure. Some of them include exercise intolerance, meaning that you aren't able to exercise as much or for as long as you previously were. Shortness of breath or dyspnea when you're walking or exercising. A lot of swelling or edema, as we call it in the medical field, can also be a sign or symptom of heart failure. Problems with dizziness or low blood pressure. And those are the big ones that I would say. Also, some other things that may be pointing toward heart failure are having palpitations or feeling like your heart is racing during times that it shouldn't be. All of those things kind of point to and kind of maybe symptoms of heart failure. There may be people who are walking on the street or running marathons who have heart failure, and there are people who are critically ill and kind of waiting for a transplant who also have heart failure. The treatment options, you can imagine, vary. There is a field of medicine that has been shown to help recover the function of the heart. We call it guideline-directed medical therapy, GDMT. Those are for patients to try and recover their heart function, and there are several medications that oftentimes get added at the same time to make sure that we're doing everything that we can to try and recover that heart function. And unfortunately, some people progress or some people are too sick to get those medications, and they may require what we call mechanical circulatory support, meaning a machine basically helping to preserve or restore the function of the heart while they're waiting sometimes for advanced therapies for heart failure. Heart failure is diagnosed by an echocardiogram usually. From the echocardiogram, you can tell whether the function of the heart is reduced or if it is normal. You can also tell whether there's valves that are affected that may be the cause of heart failure. You can also tell if there's congenital abnormalities in the echocardiogram that may be causing heart failure as well. You can also tell if there is other affected organs, including the lungs. You can tell if there's hypertension in the lungs from the heart failure that has been brewing kind of in somebody's heart. So diagnosis is by echocardiogram. You should contact your cardiologist when you are having symptoms of heart failure that you hadn't previously discussed with them, especially if you're noticing that you're having increased weight gain, if you're noticing a lot of swelling, if you're noticing that you can't breathe when you're sleeping or even when you're walking, if you are feeling lightheaded or dizzy. All of those things are kind of signs that you should really contact your cardiologist, and they'll work together with you to make sure that you're on the appropriate treatment. I always recommend my patients go to heart.org in order to look at those things, which include eating well, managing your blood pressure, getting enough exercise, getting enough sleep, managing stress, managing your blood glucose, amongst other things to try and preserve your heart. Because like I said before, a lot of the things that are risk factors for heart disease, coronary disease, are also risk factors for heart failure. So if we can manage those things, the risk of you developing heart failure is less.